Om Swastiastu. Good morning, doctor and friends. We are from Group B7. We're going to be presenting about low protein diet. Please enjoy.
Hello, my name is Shantika with my student number 106. Here I'm going to explain our paper introduction. First is background. Food is a source of energy. Moreover, our body really needs nutrients from food to keep it healthy. However, mostly every disease also comes from uncontrollable food consumption and becomes our all-time challenge to deal with. Therefore, diet is a common way to help us have a good nutrient intake modification. In medical practice, diet is used to protect the patient from many chronic, non-communicable diseases and even become one of the medical management interventions through nutrition therapy. One of them is low-protein diet or LDP. Restricting dietary protein early in the course of renal disease can minimize the adaptive changes and thereby retard progressive deterioration in renal dysfunction. This also challenges physicians to maintain adequate nutrient intake and nutritional therapy while ensuring favorable nutritional status and correct protein and energy wasting. LDP is very effective, but many physicians still fail to control renal dysfunction. Meanwhile, hazardous consideration in dieting, spatial precaution, population administration are also become concern of this type of diet. Therefore, with the student project in the block of Clinical Nutrition and Disorders, the writer intends to give further study about low-protein diet or LDP to understand more in depth in order to execute a low-protein diet plan for patients. And the second one, here we have already listed our research questions followed by purpose of the research and benefit of the research. Basically, we're going to talk about the definition and description of a low-protein diet, epidemiology regarding to the low-protein diet, the purpose and benefit of low-protein diet, hazardous consideration and or side effect on a low-protein diet, spatial precaution on a low-protein diet, and the last one is suggestion to the people applying a low-protein diet. Thank you.
Hello, my name is Zaki Arafia ID with student number 122. So today I will describe about low protein diet. So low protein diet is a type of diet that reduces the consumption of protein, typically so that it constitutes 4 to 8% of daily calories. For comparison, the average person is generally recommended to get at least 10 to 50% of their daily calories from protein. Reducing protein intake can be therapeutic for people with a certain condition. Excess protein is typically broken down by the liver and produces waste product called urea, which is excreted by the kidneys. Reducing protein consumption can ease the workload of liver and kidneys, which can be beneficial for people with liver disease or impaired kidney function. Recent studies have also found the association between low protein diets and several health benefits for the general population, such as increased life expectancy and reduced risk of chronic conditions like cancer, heart disease, and diabetes. That's all for today. Thank you.
Hello, my name is Putri Indria and my last year number is 200, and I'm going to talk about the epidemiology of low protein diet. So low protein diet is very good for people who suffers from kidney diseases, liver diseases, and as well as metabolic diseases. But in general, if people wants to do the diet, it is also very good as long as their physicians are allowing them or approving them to do the diet. In Japan, this kind of diet or low protein diet have been done for more than 50 years to help people who suffers from chronic kidney diseases improving their health. And it is not only happening in Japan but also in India and Europe, especially in the UK. Nowadays, in the UK, if people wants to do the diet, they can just go to their physician and ask them to prescribe the diet for them. That's all I can say about the epidemiology. Thank you for your attention.
Hello, my name is Pratista and my student number is 227. So now I'm going to explain about the purpose and benefit of low protein diet. Low protein diet or LPD is usually used to help cure several health conditions such as liver dysfunction, kidney disease, or other diseases related to protein metabolism. Some research has also found that LPD may be used to extend longevity and offer protection from chronic diseases. In general, excess protein will be broken down in the liver to produce urea, which will be excreted by the kidneys. LPD, which is applied to people who have impaired liver dysfunction and kidney disease, is expected to ease the workload of the liver and kidneys by reducing protein intake. This can increase protein metabolism and avoid the buildup of urea in the bloodstream.
Hello, my name is Nada Pramesti with student number 167. Now, I'm explaining about the hazard or side effect of low protein diet. Substantial evidence from a study explained that someone with a nutritional intake that is rich in protein, the individual will easily feel full, lose weight, and can improve glycemic control. However, it is inversely proportional to the small amount of protein intake. It will increase energy intake due to the amount of carbohydrate and fat. This is related to other studies that use mice. Consistently limiting protein in a moderate amount was associated with change in body composition, among others decreased lean mass, increased body fat, which leads to the development of fatty liver. Thank you.
Hello, my name is Manigandan and the last 3 digits of my name is 249. Today I'll be talking about low protein in children. As a child, not getting enough protein can lead to more serious side effects. As a matter of fact, the essential amino acid is so important for kids for their growth and every single part of their body. Protein provides as important essential amino acids that contribute to their mental and physical health. Without enough protein in their diet, your kid may experience symptoms such as lack of concentration, fatigue, shortened growth, and lowered immunity and more. Thank you, that's all from me.
Hello, my name is Sarah Prabudina Sakti with the student number of 253 and I'll explain about the special precaution of low protein diet. So the consumption of protein triggers response in negative behavior, energy expenditure, and metabolism under homeostatic controls. Protein affects intestinal calcium absorption. Protein malnutrition could result in multiple problems such as anemia, physical weakness, edema, vascular dysfunction, and impaired immunity. Amino acid that could not be degraded to portal vein needs proteins to synthesis in skeletal muscle and other tissue, but with protein limitation that leads out to problems. Proteins being 1/3 of bone mass provide the structural matrix of bone. Due to LPD could cause osteoporosis. Therefore, an adequate proper protein in the diet is essential for maintaining bone mass and maintain other body parts. Thank you.
Hello, my name is Kutubina Masadanardika with student number 139. Now I will explain about the suggestion to the people applying the diet. While following a low protein diet, it's important to make sure you are getting nutrients from other sources to prevent nutrient deficiency. However, because of its potential heart health and risk, a low protein diet should only be carried out under medical supervision. It's very important to consult a doctor or a dietitian before starting a low protein diet. Not only can they help to determine if it's a good choice for you, but they can also provide guidance to ensure your diet remains healthy and well-rounded. So that's all about the suggestion. Thank you.
Hi everyone, my name is Daniel Sutama Sirmoringo with last student number 045 and I'm going to present you an example of low protein diet menu which used for chronic kidney disease patient in Cape Town, South Africa. For the breakfast, patient can have 4 heaped tablespoons of oats, 125 ml of milk, and 1 teaspoon sugar. For snack, patient can have bread rolls, matchbox-sized cheese, quarter avocado pear. For lunch, patient can have 3 heaped tablespoons of rice, 1 heaped tablespoon of bobotie, which is a South African dish, half cup mixed vegetable, and 1 medium onion in this, with 1 teaspoon oil or 2 level teaspoon margarine for cooking. For the snacks, patient can have 6 rambutans, and lastly for dinner patient can have 2 heaped tablespoons of cooked pasta, chicken, and half medium cooked onion with 4 medium sliced green pepper and garlic cloves, and 1 teaspoon oil or 2 level teaspoon margarine for cooking. Thank you.
Hello everyone, my name is Surjira Andeskosasi with last 3-digit student number 021. So I'm going to present another sample menu of low diet protein for patient with chronic kidney disease. For breakfast, patient can have 3/4 cup of rice, 1 egg, half cup of vegetables, 1 tablespoon of oil, 1 tablespoon of sugar, 3 tablespoons of honey, and 4 tablespoons of milk powder. For snack at 10 a.m. and 21 p.m., patient can be provided with 1 low protein cake and 2 tablespoons of sugar. For lunch, 3/4 cup of rice, 1 medium slice of meat, half cup of vegetables, 1 medium slice of papaya, and 1/2 tablespoon of oil, 2 tablespoons of sugar. For snack at 4 p.m., 1 low protein cake and 1 tablespoon of sugar. And for dinner, 3/4 cup of rice, 1 small slice of chicken, half cup of vegetables, 1 medium slice of papaya, and 1/2 tablespoon of fish oil, and 2 tablespoons of sugar. And here is the nutritional facts of sample menu that I mentioned before. Thank you.
Hello, my name is Dera Cynthia Augustine with my student number 069, and I would give explanation about the conclusion of this presentation. So, Low protein diet is type of diet that reduces the consumption of protein for about 4 until 8% of protein daily calories. This could be translated about 20 until 50 grams of protein a day, depending on each person's daily calories intake. For purpose and benefit, low protein diet is really good for people who suffer from liver dysfunction, kidney failure, chronic kidney disease, as well as people who have some metabolic disorders. This diet is expected to ease the workload of the liver and the kidneys by reducing the protein intake. But this diet also has several negative effects. Low protein diet will increase energy intake due to the amount of carbohydrates and fat that is consumed in excess. Moreover, consistently limiting protein in moderate amount was associated with changes in body composition, decreased lean mass, and also increased body fat, which led to the development of fatty liver. Because of that, there are some precautions and suggestions for patients that do this diet, and for the clinician, we have to find meals or supplements for fulfilling the side needs of the patient that are adequate for maintaining other body parts and nutrition. So, that's all that I can say about the conclusion of this presentation. Thank you.
That's all from our presentation. Thank you for your attention, and we close it with Paramasanti. Om Santi Santi Santi.